Hey everybody, welcome back. Was that a minute?
That was over a minute. You're wearing a different shirt.
Oh. Okay. How about we demonstrate?
Let's demonstrate these.
Combitube. We're going to start with that. Dennis, we have our mannequin here. Poor guy. Whenever we're going to insert a device like this, we always want to make sure that it is intact and checked, okay? So, most important thing is obviously there's no, cracks or breakage in the tube, but we want to check these cuffs. Okay. So do me a favor and hold on to that.
Absolutely. So every time you get these out of the ceiling, you want to make sure that they're going to work because bad things happen when they don't work.
I'm going to check my balloon cuffs here and make sure there's no holes in it, because this is what's securing it.
Okay? Right.
That's my first line of securement.
You're kind of routing the air directly into the lungs, kind of like a dam routes water.
Exactly. So now the bottom cuff here, we're going to go ahead and inflate that. I'm going to make sure that's good. Looks good?
Yeah, we're good to go.
Okay. So we're all set up here. So a couple things. When we insert this device, it is a blind insertion. So I'm not using any tools or instruments to view the cord.
No lights or anything like that.
Yeah, and remember,
more just by feel.
It's going in the stomach too. It's going in the esophagus.
Okay.
I do want to put some lube on here. This particular device comes with, obviously, the tube. Comes with a large syringe, a medium syringe. I'll explain later, and some suction tubing. We do want to apply lube though, so we're going to put just a little on the back and a little on the.
You're not going to lube like the complete device.
No, because I don't want to mess with the holes here.
Gotcha.
Okay. So I want to get that in. Now, again, I'm not using any tools, but what we do is, it's kind of weird, I know, but we're going to just put our thumb in here and we're going to just move their tongue back a little bit, so I can get a little bit of a smoother insertion. So once I'm going in, you're going to see I'm going to go, and you're going to see these two black markings. We want to end up at the teeth range right around anywhere in between those two black markings.
Okay.
So that feels pretty good to me. And with the mannequin, the esophagus is here at the bottom. These are lungs. So you should be able to kind of feel that back there, which I do. So I feel like I got a good insertion. So let me have you hold the tube. So I want to keep my marking. I'm going to fill this up. Okay. So that is going to secure it in the larynx, area.
So yep.
The second tube is going to block off the esophagus, so I shall not be able to push air into the stomach. Okay, so everything is secure. So in theory, the blue tube, remember, is the one that should lead to the ventilation ports that should be able to ventilate the lungs. The clear tube, which is now blocked off at the bottom, is the one that leads to the stomach.
Gotcha.
So if I push on the blue tube with the bag valve mask attachment, I should get those lungs to rise. And let's see, we're a little bit, there we go. So
and the lungs rise, you see the chest rise at this point in the back of the rig.
Yep, so you can see the lung bags are rising and there's nothing in the stomach. Now,
and so if you're really kind of not really paying attention, you're in the back of the rig, you got multiple things going on, you accidentally plug it into the other hole, what's going to happen?
You should be okay. Now, there is a small hole at the bottom of this clear tube, which is used for gastric suctioning. But with that bulb cuff inflated, when I push, you're going to see it's going to be a lot heavier, more resistance. Maybe this stomach will move, get a little air in there, but it's going to be very blocked off, and the lungs. So you'll know right away that you're not getting chest rise anymore. It feels tougher to bag, so then you'll realize real quick, I need to switch back.
You got a tactical feel on the there, and then you'll also see less chest rise.
Yep.
Now you're pushing on the stomach. Yeah. There's stuff gurgling down there that might just geyser on you, right?
If CPR is in progress, right, there's going to be some air and a lot of movement in the stomach.
A lot of trauma going on down this area.
They added this piece, which is actually called a gastric content deflector.
Okay.
And we can put it on the clear tube here, and I'm going to make sure and not point that at me. So we'll point it at you.
Yeah, right at me.
So when, it'll go that way, and I'll be fine.
You'll be fine. That's the most important part there.
And then if it gets to the point where it's really starting to gurgle up and you're really starting to see a lot of contents coming up, maybe even coming up through the tube here, it does come, if I can hold it, with a nice little suction catheter.
Gotcha.
So I'm going to insert this. Now remember, that little tiny hole at the bottom of the clear tube, that's what that was designed for.
Because you've got two tracks running down that one tube. One track's going straight in there.
Yep.
Past that big cuff that we inflated, right into that.
And so that's going to be right in there in the stomach area. And now I can attach my suction unit device to it and turn it on. And I can just slowly pull this tube out. and I'm going to get a lot of that contents up.
Right.
So, last thing we'll show real quick is that, for added security.
Yeah, this thing's on pretty secure
It's
right
on
now,
pretty
but
good.
I've driven on California roads. I know how they are.
Yeah. So it is definitely can work with a Thomas tube holder. We sell these, and I actually do recommend this because once you're in a good spot and you're getting that good lung rise, you don't want to mess that up because airway's everything, right?
Gotcha.
We got to keep the airway intact. So we can actually insert one of these, and then
Come underneath here, and we'll go ahead and secure this down. And then usually we want to secure it just a little bit first, and we want to make sure, and then we're going to
we're going to close off the screw, which is going to make contact with the tube and secure it.
You're
And
a
now
lot more
this
secure.
thing
So
looks
this
good.
Thomas tube is sold separately.
It is. It is
And-
sold separately. It's not part of a kit, but most ambulances, fire engines, they're
Gotcha.
they're going to have.
So from a sales perspective, this would be a really good kind of cross sell to sell
Absolutely.
with these tubes if you're trying to sell
Yeah.
those.
And I would hope that most people already are doing this because people know when they have a good airway, they don't want to lose it. Okay.
There's some counties where they may not be.
You never know, right?
Yeah,
You
they
never
may
know.
not be up to date on the newest and the slickest.
So we're going to go ahead and deflate this, and we're going to pull this out. Now, normally, if I established an advanced airway, I'm not going to pull it out. I'm going to leave it. The only way it would ever come out would probably be on its own by the patient if he started becoming conscious again.
Or if some
And
sort
bucking
of
the tube.
difficulty or something happens.
Something like that. But usually, it's going to stand in the hospital.
Leave it
We'll
for
handle
those
that.
doctors, those medicine nurses.
But I will deflate the cuffs on this one and go ahead and just pull it out. Okay, let's move to the
got
King.
the King tube, yeah.
Now we got the King tube. King tube, very, very, very similar, except it's one tube, right? There is no hole at the bottom here, but the ventilation ports are the same.
So there's
okay?
no hole going from the top
Nope,
straight in.
there isn't. So what we want to do is let's go ahead and test it.
Mm-hmm.
So we want to make sure, again, our cuffs are looking pretty good. Yeah,
Cuffs are good. They
Cuffs
are
are good.
inflating.
they are inflated.
They're holding the air.
There's no holes, so that is good. So now this one also you can apply gastric suctioning tube. Now the kit that we sell doesn't come with the tubing, but most rigs will have this on as a separate item. It's got a little hole back here, and I'll show it, but it feeds. It's completely separate, and it will feed into.
It kind of runs
stomach there.
parallel to the
Yeah.
tube that goes straight into the.
But it's not
esophagus.
connected to this port.
Okay.
Right, so it's totally.
So the
separate.
air that the port's going in.
Yep.
The airport is nowhere near.
Nowhere near that. It's a separate little small lumen there.
Does that have a deflector tube, or that one does not have a deflector?
It does not have a deflector tube. The
Okay.
reason is because it's a single port, and the BVM is going to be on it, and it's very small here. So when you are suctioning up, it's not a large.
If something comes out, the wealth of
Yeah,
information that's
exactly.
going to be shared with you.
Exactly. So we checked the bubbles. We're pretty much ready to go. Again, we do want to put some lube on this, right? The kit that we do sell, it comes with the tube, a syringe, and actually this one does come with a packet of lubrication, which we'll show later.
And did the Combitube, forgive me, did not come with lubrication?
It does not come with lubrication.
But
Remember,
that's something most rigs have.
that's something most rigs will have definitely available.
Gotcha.
So it shouldn't be a problem. Okay, so again, we're lubed up, ready to go. We don't want to block the ventilation. So just on the back and on the thing here, same idea. We're just going to pull that tongue back just a little bit, and I'm going to go ahead and push it. Now it's got markings here, and I always try
Actually
to
numbers, yeah.
Yeah, so I try to hit kind of right in the middle there. So I'm going to do 15. Okay.
Okay.
So 15 is my mark. So why don't you go ahead and inflate this cuff for
Oh
me?
man, you know what happened last time we did
I
this,
know.
right?
This could be dangerous.
Yeah.
Go ahead
Stand
and-
back. There, we're gonna go. Let me know when.
Keep going. Keep going. Keep going. Okay, that's good right there.
Good.
Yep. I don't know if you got it in there. Let's go ahead and try that again. Push it in there. Push it in there hard. Okay, now
There we go. Let me know.
keep going all the way. All right, now we're in there. Okay, so I don't want you to tug it, but just go ahead and feel it.
Yeah.
pretty secure.
No, that's secure unless you
Pretty
make a
secure.
very conscious effort to rip that thing out.
So remember, we got those two cups, one that's in the larynx area, and now the bottom of the tube has a small one. That's going to block off the inlet to the stomach. So in theory, I should be able to do the same thing. I know I'm at my mark, 15. I'm going to pop this on, and I should get some lung rise.
There you go. You got
There you
your
go.
lung rise.
Nothing coming out of the stomach. I have a good, solid airway right now. And then finally, we talked about that suction port. So same thing. If I'm bagging and I'm feeling like there's some contents coming up, I can fish this thing right in its own little separate. thing. And this is not going into the lungs. This is going right down into the stomach area. Hook up my suction, pull it right out, and we're done. And then let's just do the Thomas tube holders for this one too. So double, you can use the Thomas tube holders same way for this. We're gonna plop it right in there.
We're going to feed it under the hip and there we go. Let's go ahead and secure this. Let's try to do that. There we go. So it's in there. We're gonna go ahead and close it up.
Now we do want to make sure once we do any movement on a tube, we want to redo it. So I would have done that with a Combitube as well.
Absolutely.
But I want to make sure that it's still in its same place. Now we've got a very, 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 very secure airway. Patient's good to go. Airway's most important thing. That's the king in the Combitube. So stay tuned. Our next segment, which is going to be part 2 of the advanced airways, we're going to move into supraglottic airways and LMAs, laryngeal mask airways. Same concept, different design. Okay, so I'm looking forward to that.
Yeah, so am I.
Hope you guys are too. We'll see you in a few minutes.
Start the timer.
Bye.